Hello students, welcome to Lazy Tutor where you can learn nursing simply. The topic which we are going to discuss today is about menstrual cycle. So, what is a menstrual cycle? It is a monthly blood discharge which occurs in non-pregnant women in every month. So, it is counted from the first day of one period to the first day of the next period, and it will be almost about 28 days. So this menstrual cycle is a 28-day cycle in normal women. What is actually happening in this menstrual cycle? It is the endometrial shedding is happening. Endometrium is the innermost layer in our uterus. So, due to the influence of some hormones like estrogen and progesterone, our endometrium will be shedded, and it is the main process which is happening in this menstrual cycle. So, these are the general introduction about our menstrual cycle. In menstrual cycle, there are two types of cycles are there. First one is uterine cycle, another is ovarian cycle. Uterine cycle is actually what are the changes that occurs in the uterus during the menstrual cycle, and the ovarian cycle is actually the changes that occurs in the ovary during the menstrual cycle. So let's see the uterine cycle first. There are 5 phases in the uterine cycle. The first one is early proliferative phase, second late proliferative phase, third secretory phase, fourth premenstrual phase, and lastly the menstrual phase. So these are the 5 phases that occurs in uterine cycle. So now let's study each cycles in detailed way. The first one was early proliferative phase. So this happens during our menstruation. The time period is from 5 to 9 days, within 5 to 9 days of menstruation. During menstruation, our endometrium is shedding. So when early proliferative stage occurs, the endometrial thickness will be about less than 2 millimeter. Blood vessels are numerous and prominent in this stage. Estrogen helps in the regrowth of endometrium for receiving the baby. These are all about the early proliferative phase. And the next stage is late proliferative phase. It occurs until ovulation. The time period is from 9 to 14 days after menstruation, and the endometrium gets thickened than the previous phase, which is the early proliferative phase, due to hyperplasia and stromal cell accumulation. So due to the hyperplasia and stromal cell accumulation, the endometrium will get thickened. In this stage is completed by the formation of 3 layers. Okay, late proliferative phase is completed by the formation of 3 layers, that are basal layer, functional layer, and spongy layer. These are the 3 layers which are formed in the uterus. So within the after the formation of these 3 layers, this stage will be completed. So now let's study each layers of the endometrium. The first one is the basal layer. Suppose this green is the myometrium. Myometrium is the middle muscular layer in our uterus. Suppose this green is myometrium. Then basal layer is a layer which is above the myometrium. So this orange is basal layer which is seen above the myometrium. It is about 1 millimeter in thickness. Shedding won't happen in this layer. Shedding won't happen in this layer. Next is our functional layer. Functional layer is a layer which is seen above the basal layer. It is 2.5 millimeter in thickness. Changes in this layer are influenced by the ovarian hormones. So ovarian hormones influence the changes in this layer. Next is the spongy layer. What? The spongy layer. Spongy layer is a layer which lines or covers the functional layer. So spongy layer covers or layers the functional layer. So these are the 3 layers of the endometrium. Functional layer and this basal layer, spongy layer, everything are the different layers of the endometrium. Endometrium is the innermost layer of our uterus. The second type of cycle in the menstrual cycle is ovarian cycle, which basically means what are the changes that occurring in the ovary during the menstrual cycle. There are four types of phases are there in ovarian cycle, that are menstrual phase, follicular phase, ovulation phase, and luteal phase. Let's see the first phase, which is the menstrual phase. It lasts up to 1 to 5 days. 10 to 80 ml of blood flow will occur. Cramps will happen, and in this phase endometrial shedding takes place. Next is the follicular phase. Follicular phase lasts up to 1 to 13 days. In this phase, eggs starts to grow in the ovary with the help of pituitary hormones. Only one egg will get matured among them on the 13th day. Follicular stimulating hormone will line the uterine wall with blood vessels. The third phase is ovulation phase, and it occurs on the 14th day. Luteinizing hormone has an influence in this phase. The egg will get released from the ovary and goes to the fallopian tube through the fimbriae. Through the fimbriae, the egg will get released and goes to the fallopian tube. The last one is the luteal phase. Luteal phase will occur on 15th to 20th day. The egg will stay on the fallopian tube for 24 hours for the fertilization with sperm. Due to the absence of sperm, this egg will be broken up and leads to menstruation. So these are the four phases in the ovarian cycle. So that was all about the menstrual cycle. So menstrual cycle is the monthly blood discharge which occurs in a non-pregnant woman in every month. It is of 28-day cycle. It is of two types, that are uterine cycle and the ovarian cycle. Uterine cycle consists of five phases, that are early proliferatory phase, late proliferatory phase, secretory phase, premenstrual phase, and menstrual phase. And in ovarian cycle, it is of four phases, that are menstrual phase, follicular phase, ovulation phase, and luteal phase. Hope you understand today's topic. If you have any doubts, please do mention it in the comments. Thank you.